All right, gang. This is the medical gas therapy lab. Okay, I'm going to go over the different components of the high flow system, the components of the low flow system. You guys got to remember the indications for low flow and the indications for high flow. Okay, I'm going to show you each modality or each device, and we're going to kind of recap some of the liter flows, and this will be available to you at your disposal to always go back and look at, to remind you how we do high flow and low flow. Okay, not going to do any total flow systems on the board. You guys got that in the lecture. If you have any questions with that, you can email me and we can go over it together. All right, now you have to excuse this. This is makeshift, so I'm doing this the best way I can so that you guys can have a visual of the actual lab. I will be moving the camera from time to time so I can make sure you see what I'm talking about. Okay, all right, first thing I want to do is kind of recap, not really recap, but go back to the last lab, which was the gas cylinder lab. I did show you the 8-cylinder and the E-tank, but now we're going to show you, of course, the Thorpe Tube again. Okay, now this is a compensated Thorpe Tube. All right, this is the Thorpe Tube. It has your liter flow here. This is your connection to the wall, right? This is one that screw in. We have some that screw in and we have some that punch in. Okay, on this side of the lab we have the screw in side. On the other side of the lab it is a quick connect, right? It's just a quick push in and it locks in place. Of course, this would be medical air. All right, this is medical air. I have some model numbers and stuff like that on it. Tells you the total flow, not total flow, but tells you how much flow you can turn on to it. Okay, now we said this is compensated. See this little, see that float in there? All right, okay, it's a float. When I plug it up to the wall, if it rises and falls, we know it's compensated, right? Don't forget that. All right, this will be for the oxygen. This is an oxygen Thorpe tube, or known as a flow meter. It plugs into the green, right? Oxygen is green. Plug it to the oxygen port, and same system here, liter flows, and this is the knob here on this, it's on the side to turn the liter flow up or down. Lefty loosey, righty tighty. Okay, all right, so what I'm going to do now is turn this and look over here on the wall. These are the quick connections here, and you can zoom in on your camera more if you need to. But the green one is the oxygen and the yellow one is the medical air. Okay, so we're going to hook up to the oxygen to do the rest of the lab. So what I'm going to do is I'm just going to put this on here and screw it in. Okay, once I have it screwed in, I can then turn up the flow. Hear that? This is the flow. All right. Now, remember that everything after the flow meter is the DISS, right? The DISS. And I told you these flow meters have these threaded, right? It's the DISS, which is threaded, right? So everything that you put on that has to be able to fit that. Sometimes our nasal cannula. So we're going to start with the low flow system. The low flow system. Remember, the low flow system, you must have a tidal volume of 300 to 700, respiratory rates 25 or less, and a consistent ventilatory pattern. That means consistent means it's the same. It's the same. Whether if you're breathing 20 times a minute, then it's 20 times a minute. It's not 25 and then 10 and then 3, then real deep, real shallow. That's inconsistent. Somebody like that you want to have on a high flow system. All right, but for a regular breathing patient that just needs a little bit of oxygen, right? It's a little hypoxic and they need a little oxygen, then we start them out with a nasal cannula, all right? This is the nasal cannula. See that? It has the nasal prongs, also called nasal prongs. See how it hooks? This goes toward the patient, right? You want the hooks to go toward you, like going down into the patient, okay? They're gonna hook toward the patient, like a snake, right? So this is the nasal cannula. Small bore tubing, right? And this is the end. This end has to fit on, of course, the oxygen, but it would have to fit here, right? So this doesn't fit. You know, you're like, well, this wouldn't fit, right? This wouldn't fit. So what we do is we use what's called a Christmas tree. This Christmas tree screws onto the flow meter, and then we can then put this onto here. Okay, so that's what I'm gonna do now. Keep in mind, I don't like the way companies make yellow devices for oxygen. I don't understand it. But I don't have any green Christmas trees around. Let me see if I have a green Christmas tree. All right. Now, this is a Christmas tree, right? Preferably green because we're dealing with oxygen, right? Green. All right, so I'm going to plug up this Christmas tree. All I'm doing is just going to screw it on. Screw it on just like that. Right? Now I can put my cannula, small bore tubing, onto the Christmas tree. Just push it up on there, right? Then I can control my liter flow. All right, so I happen to have this now on 4 liters per minute. 4 liters per minute. Now you can't hear it really, but if I put my fingers over it, hear that? So you do have liter flow, right? So this is what it would look like on your patient. Up in the nose and behind the ears. Then there's a little tension thing right here to kind of make it snug. Now, remember what we said. If I'm on oxygen and a nasal cannula, I can breathe, right? I can breathe, I get my oxygen, and I can eat. I can talk. It's pretty comfortable at low flows. Now, if I have it jacked up to 6 liters, it's getting pretty, because it's dry now, and I got it on like 3 or 4, right? I have it on like 3 or 4. So let me show you how it looks when it's on. See that? That's on 3 liters. The ball will be resting right in the middle of the line, right? If I crank it up to 4, I crank it up to 5, right? Around 5 or 6 liters is about as high as you want to go with a nasal cannula. Remember that oxygen is very, very dry. Very, very dry. And it will dry your patient's nose out, right? And they will complain, cry, bleed, all of that. So this is the nasal cannula, low flow system. All right. Remind me not to let nobody use that one. All right. Let's see what's next. We talked about the next low flow device. If the nasal cannula just isn't hitting on right. Oh, let me show you one other thing. You may see, we haven't gotten to the aerosol humidity. That's the next section, which you'll deal with how we humidify dry gas, right? But let me show you. This is what we call a bubble humidifier. A bubble humidifier. This is for oxygen nasal cannulas. Nasal cannula is the only device that uses the bubble humidifier Nasal cannula, the only device that uses a bubble humidifier. What it does is, we plug it up. Of course, we have to take off our Christmas tree because it won't hook up to this. You have to take this off and plug it straight to this screw thing, to the top. All right, I will screw it up on here. All right. And this is what it looks like. See that? Those bubbles of oxygen, that oxygen comes down through the bottom here. See that? Comes through the bottom here and comes through the water. Now, the gas that's up in the top here is now fully saturated with moisture, right? And I would then put my nasal cannula on here. Just like that.